Hi guys, it's Allison from Racked. I'm here at Dr. Nassif's office and I'm getting Botox today, live on camera. I'll be honest, I've gotten Botox before, but I'm really scared of needles. But I have watched Dr. Nassif for years on television. I love him on Botched. So there's no one that I trust more to do this here live for you guys today. I know Botox is something that a lot of women are interested in these days, and it's a little taboo to sometimes ask about it. That's why I wanted to do it for you guys on camera and walk you through the entire process. And Dr. Nassif is going to come in here in just a second. He's super busy, but we're going to snag a little bit of his time so he can do the Botox on me. And make sure you guys ask questions throughout the whole process. If there's something that you really want to know, we are happy to answer it for you guys today. So just write in the questions and either Dr. Nassif or myself will respond. And yeah, we're going to be doing Botox all in my forehead and I can't wait. Like I said, I have a needle phobia, so hi doctor! Yay! Thanks for being here with us today.
We got 2 Facebook Lives.
We got 2 Facebook Lives.
We're doing it. Mine.
We're doing it up today. So
let's jump in.
Yeah, let's talk Botox. So what should people know before going in to get this?
Okay. Well, first of all, you're a little young. I mean, you're 30. And you've been getting Botox for a while. Since when?
Since I was 24.
Okay, why?
So, I'll be honest, so I'm obviously very pale. My dad's Irish. My dad has really deep lines in his forehead. And I was a television host for a big portion of my early 20s. And so when I was doing my television work, in those up-close shots, the makeup would get stuck and I had really deep wrinkles. And over the years, those have gone away. But I had really deep developing wrinkles early on. And I used to go into tanning beds when I was a teen.
Ooh.
I know, awful. So I feel like I was kind of seeing the repercussions of that really early. So that's why I started. And I'm kind of vain.
Aren't we all?
Yeah, right? I want to but that's why I started, so.
Okay. So I'm going to talk to you simultaneous while talking to the audience out there. I'm looking at both cameras. By the way, those can be magnified or not when you're doing Facebook Live? Can they?
They can be made bigger.
You can't go like that?
Yeah, zoom in.
The zoom in thing? So you're obviously, what you just mentioned is a little bit unusual for someone 30, but in your situation then it makes sense. Raise your eyebrow. Okay.
You want to come in up closer and look too, just so you can see? Just I want you guys both to be able to see. So that's what we got going on. It's not going to be fixed right away because Botox does take a few days to set in.
It could take up to 2 weeks to set in. It lasts on the average about 3 months. Now, here's the issue. And then you don't like that.
I hate that. Oh my God, what is that? 11s?
Yeah, they call the 11s those 2 lines, the vertical lines.
Okay.
So here's the issue. Again, remember, our whole goal is to prevent you from being botched, actually, in a way.
Yeah, right? I see what you did
Hopefully
there.
that doesn't happen with me, though. But anyway, when you do the forehead, and since you've had Botox before, but I'm going to explain this to you, but you probably already know this.
Well,
but
this
you
is
guys
for
can
everyone
listen
watching.
Out there, too. So when you do the forehead, is if we go too low, it automatically drops your eyebrows because the muscle that elevates, I have a little Botox in, so I can barely, lift your forehead up again.
Okay.
The camera.
You see me?
So this is called the frontalis muscle. This muscle here elevates the eyebrows. And if you go too low, usually about 2 centimeters or a good finger, inside this area, the eyebrow can drop.
No one wants that.
Now, because we do need this muscle to elevate. However, if you have really heavy eyebrows, your eyebrows are low, excess skin, you do this, and you're used to doing this all the time, then you're going to have a real problem. So you have not hanging brows and eyelid. So basically we're doing this more to help soften the wrinkles.
Yes.
So in this situation, I want to go a little high. I'm going to go completely across your forehead, because if I go a little bit inside, your lateral part of your eyebrows are going to go up and you're like Spock a little bit. So we're going to kind of
Not the goal.
We have to go. So that's number 1.
Okay.
2, we're going to do a little bit in here. I'm going to go light. I'm going to go small doses on you. And what are the risks? Besides a bruise, besides a headache? No matter what, even if I go way up here, it can still drop your eyebrow too much. Hopefully that's not going to happen to anybody.
Okay.
You do this. Also, when you do up here or here, there's a very small chance that the Botox, and it's not because of me being technical, but because of your anatomy, it can drop down into what we call the levator muscle and cause eyelid ptosis. That means the actual eyelid can become sleepy, and you can use a drop, a little medical drop, if you're going out to an event to get it to pop up temporarily, and it'll last on the average about 4
Okay.
Less than about 4 weeks.
So that's one thing that I think is important. Like, this is a medical procedure, and people don't necessarily think about that when they're getting Botox done.
Exactly. So, these are all the medical things. You signed a consent already?
I did.
Okay. So, in general, I have had a few patients under the age of 30, but these are someone who comes in, they already have a lot of wrinkles here, or it's genetic, or more issues like you. On a rare occasion, if someone says, you know what, I don't have the wrinkles yet here, but I'm constantly frowning. Plus, I look like I'm upset all the time.
They need to get happy.
That is an indication maybe to go and start a little earlier.
Okay.
Okay?
Got it.
So, any questions?
Well, what should people do the night before? Is there anything that they should stay away from or not do the night before?
Well, how about
The day
4 or
of?
5 days before? Let's top the ibuprofen and aspirin.
Okay.
Anything that's, and vitamin E that's going to make you bleed or bruise easier. Okay?
I haven't done that.
That's it. Other than that, again, this is usually done about every 3 to 4 months. And I'm going a light dose on you. I'm going to just do 10 units
Okay.
on your forehead across and another 10 units down here.
I'm scared of needles.
Okay?
Just
And that's
FYI.
low doses.
Okay.
Okay, we'll make it not as painful at all.
Okay.
I mean, like if a normal dose is about 20 units here, and then here it can be anywhere between 10 and 20 units.
So I'm not getting a lot.
No, you're getting a lot.
Great.
And it should just soften. We're not trying to paralyze everything.
That's the goal. Yeah, I want
It's
to
the
be able to move
muscles.
my face. I don't want to be like, hi.
Let's get some gloves.
Okay. So we're doing this. I guess we're doing it. So if you guys have any questions on either stream, let us know.
Yeah.
You got a question?
Yeah, there's a couple just commenting on the age a little earlier.
What
About
the
what,
age?
being young?
Yeah.
Yeah.
How young is too young?
Well, that's
is
the
she
whole...
too young?
So she's 30, she's been in Botox for a while, but with her skin type, unfortunately she's developing a little of these wrinkles. And so in her situation, age is really not the issue, it's more of the wrinkles here, and she's constantly frowning.
But very like an
And
expression.
so
like body
this is
expression.
prophylactic here, but here we do have some wrinkles across the forehead that are kind of starting to get etched in. But in general, I would say that if we have to look at my population for getting Botox under the age of 30, really low.
Low.
Yeah, it's probably like 5%.
So
Between 30 and 40,
It rises a little.
pops up.
so stage is 18, and she's wondering if that's too young.
Yeah, she's way too
18. Okay.
Way too young.
Okay.
18 is ridiculous. Unless somehow you have some horrible gigantic wrinkle across your forehead or somewhere, that's way too young. You know?
Oh my
And I know everyone's getting the fillers in the lips at 18 and 20, and I'm not a big fan of that, but but now, like, if I go out somewhere and I see actually friends of my nephews, like Chris, who's doing this right now, or his brother, and these young ladies are like in their early 20s, they all have big lips.
That's the thing.
That's the thing, everyone's doing their lips, so just be a little careful about that.
Is this preventative? Because that's like
The-
the common thing where it's like, oh, it's preventative. Like,
Well, it is preventative, but
Okay.
again, there's a limit of when you start. And I'd have to see each person individually to see what their skin looks like. I can just tell, looking at your skin, that this is okay for you to have. You know,
oh, yeah, no.
Because you've been doing it for a little while, you're 30, so you're not too young. And I'm wearing this, by the way, which are these are loops. So I can also look for little veins. Hopefully we can miss those veins.
Okay.
I'm going to wipe down with just a little bit of alcohol.
What about the FDA? Someone said that it's not approved at the bottom, from the bottom of the eye, only approved in certain areas. Is that true?
Yeah, well, first of all, there's called off-label use, which most doctors will do off-label use of different types of things in medicine. And then the FDA will approve certain areas. Under the eye, doctors can do it. They've done it before, but I'm not going to discuss the legal aspects of that on this Facebook Live about what off-label use versus FDA approval is. However, doctors have done it in these areas. The issue with doing it in the lower eyelid, sometimes it can make it a little bit rounder, pull it down. Sometimes it can work, but I always try to stay away from the lower eyelid.
We're not doing
And
that, right?
also, if you do the lower eyelid, you can make the little fatty pocket become more prominent because that muscle is not as tight anymore. We're not doing crow's feet, we're only doing forehead, and we're doing glabella. And this, Dr. Irvine, explain what these things are.
This is
To our lovely-
an ice roller to help
Ooh.
numb the pain a little bit. And then this is a vibrator
A vibrating device.
A vibrating device, which distracts.
Used for what?
Yeah.
Yeah. The vibrating is just going to actually make some of your nerves
Oh, God.
actually feel sensation, which might take away the sensation in the current
Okay,
area.
okay, I'm
So-
like, woo,
so
that
this is
feels
cool.
nice.
I'm going to go all the way over.
Okay, yeah, get me nice and frozen.
Okay.
Okay, I'm gonna close my eyes just because I'm a little
All
nervous.
right. Raise your eyebrows for me.
Okay.
Okay.
So guys,
You
this is
can
live,
get
people. This is
close
happening.
in. You can guys
Okay.
get close if you need to.
If you're wondering right now, I don't feel a thing so far.
All right, but let's not now jinx it, for God's sakes. Wait till I'm finished. Then
Okay.
you say that. Raise your forehead. Okay, relax. This is a 32 gauge needle, which is pretty darn small. Raise your eyebrow. Okay, relax. Okay, so that's
Okay.
the forehead.
Okay, I'm alive.
How bad was that?
Honestly, on a scale from 1 to 10, it was a 2.
Okay,
Not
cool.
painful at all, and
That's
it was
good.
the best I've ever had. To be honest, I've gotten Botox a lot, and I did not really feel that at all.
Okay, now we're going to do the glabella.
Okay.
Go ahead and scrunch down. All right, we're going to do 2 units here, which is this called a procerus muscle. And then we're going to do 4 units. And again, this is small dosing. All it's going to do is weaken the area a little bit. Scrunch down. This one can hurt just a little bit more sometimes than the other one. All right,
Okay.
done with it.
Are we done?
Yeah.
That was so easy. Am I bleeding?
No, no, you're not going to bruise at all.
Okay.
Give me your left hand.
Left hand?
Yeah, or do you want the ice? I mean,
No, I don't need the
know.
ice. That was so easy. You were so good. Oh my gosh. So what do we do now? What's the aftercare like?
So
for
don't
this?
don't lie down for about 3 hours. Don't touch the area after you leave here.
Okay.
And we don't really know if it works yet, but we tell our patients to move those muscles for the next couple hours. So elevate your eyebrows,
Okay.
scrunch between your eyes, and then give that anywhere between 3 and 7 days before it kicks in. And again, I give you a sub-therapeutic dose, a weak dose. Weaken the forehead, weaken this. Everything is just weakened.
That's good though. That's what I want. I don't want to look fully frozen.
So that's it for the Botox.
But I want to talk about your skincare line.
Okay, my skincare line, we'll do that. Do you have any more questions about the Botox?
Can I work out?
Good question. They haven't really shown that working out immediately after is going to cause problem like with the diffusing into areas that we don't want it to. But I would say if you could, maybe work out this evening. Maybe wait
Okay.
6 hours.
So tomorrow would be better though.
Possibly, yeah. It's always a good idea to get this like after you work out in the morning.
Got it. Perfect. Well, that was so easy. Thank you for doing that. I can't believe I did it live. Oh my
yeah,
god.
let me go. So you have these small little
Take a look,
things
you
here.
guys. It
and
really
then-
didn't hurt at all, I would tell you guys. I faint when I get my blood taken, so if that's any indication.
Okay.
It was
And then
easy
the
peasy.
small little bumps will go away.
Okay.
So that's it for your forehead. We'll wipe that down a little bit later on. You want to talk about skincare?
I do. What are some products I
Alright.
should be using?
Let's go on this look. All right. Dr. Irvine, you could, whatever you want to do, and it's up to you now.
Thank you so much, Dr. Irvine.
my pleasure.
Yeah,
Hey.
it's great.
So, one of the questions is, by the way, this is an important thing, is age, skincare products. When do you start, rather than Botox, when do you start using skincare products? Now, we want to start building up the collagen and keeping the elasticity inside. And
As long as possible,
As long
right?
as possible. So you can start this probably in the 20s. Again, depending on what you're using. And there's different products now. This, I'm just going to tell you what they are real quick.
Yeah.
And this is something that's a Decolift. This is for especially someone who's a little bit older, for the neck and the décolleté. And that's something for you, no.
No?
Unless you've damaged your chest already at the age of 30 from the sun.
Sun, a little bit.
But just on Home Shopping Network, for example, hsn.com, there's like 1,000, not that many, but there's great before and afters. This is the Hydra Screen, which I recommend for everybody. So
That's great.
you want to keep hydration, which is really important. Hydration. This has hyaluronic acid microspheres, and also retinol, which helps reduce fine line and wrinkles. But you want to hydrate. So with hyaluronic acid, like a filler, you guys hear about fillers and the Juvederm and Restylane.
And that's different
That's all
from Botox.
hyaluronic acid. What that does is it's a gel, which already adds volume. But in addition to that, what it does, it sucks in water from other areas. That's why sometimes you have to be careful with putting fillers in the lower eyelids area here, because it can cause some chronic swelling. So with this, is give me your hand, for example. So this here,
back
give me
of
the
the
back of your hand. Yeah. Now just do this, and this is going to go on a little bit oily, then it dries to a matte finish.
Oh, I love it. It's got kind of like a medium viscosity too. It's not super oily.
And this is something you can use on your face, your neck, your knees, your elbows,
Really?
anywhere it's dry. And then what's going to happen is with these hyaluronic acid spheres,
It's beautiful.
what's going to happen for the short term and then long term, it's going to actually pull the water into those hyaluronic acid spheres. They hold their weight 1,000 times in water, which means you have like a little microsphere.
Mm-hmm.
It sucks in water and you hydrate your skin.
Genius.
Not moisturizing, hydrate, because we all lose. So this is something you can do. Wipe some on your other hand too if you want. So you can do this
Feels so
basically
nice.
from day one.
What's the price on that?
I have no clue. I don't know. Either
You can buy it online.
You can either buy it at, let's see, 3 places to buy these things.
Yeah.
HSN, you look under the Dr. Paul Nassif, put the a little thing, or you can go to nassifmdskincare.com or come to my office.
Come in here?
So, by the way, in 5 minutes, which will probably be off air, you're going to see this plump up.
I already can feel it actually.
Okay. It's going to plump up because it's pulling in moisture, because these hyaluronic acid spheres get big. And then long term, you have the retinol for the wrinkles.
Retinol's the best.
So that's something all ages. You know, then I have the AM and the PM. This is the day therapy and the night therapy. They all have everything, by the way, on the skincare line. Most of the products have something called ethyl absorbic acid, which is a very stable form of vitamin C antioxidant. That's in the base of these. Okay, I mean, I just use this a little bit, and I haven't used it in a while, and I can tell that I can feel the vitamin C working.
Yeah.
In addition, the night has retinol. Again,
So you're big on the retinol.
retinol and vitamin C combined is like a 1-2 punch for getting rid of wrinkles. Also, this one we have before and afters too, which shows a lot of the brown spots, irregularities, blotching, helps get rid of it. And again, we have that on my website. These before and afters.
Awesome.
Basic day cleanser, and this has matcha tea in it, and also has the ethyl absorbic
Matcha.
vitamin C.
What does the matcha tea do?
Okay, antioxidant. So all these things, and you don't get that in a cleanser. And vitamin C. So that all ages.
All ages.
Hydroscreen all ages. This is another line. This is my biorhythmic line, which we're not going to talk about right now. This is something you can use 3 times a week. It's almost like it's an overnight stay-on mask.
Oh, it's like a sleeping
It's
mask.
a sleeping mask.
Great.
But it actually absorbs in your skin. So just to show you what that looks like. Here, let me see. I'll just show you.
So you put it on and then
You
in
put it
the
on and
morning
then it
it's
rubs
gone,
in.
right?
Yeah.
Okay.
So that rubs in. That you can leave on all night long, so you know that you're going to get hydrated overnight.
I love that.
By charging your phone, you know for sure that you're doing these 2 things. Under eye smoother, again, different ages, especially if you have little bags of fat. This will help tighten that. And this has eye cereal in it, which is one of the strongest components to get rid of the lower fine wrinkles in your eyes. That's under eye. Here's the night. That's the periorbital for the crow's feet area.
Oh, that's right here.
And this has something called Vin Uplift in it, in addition to the ethyl absorbic acid. Vin Uplift, what it does, you put this, especially for someone who's kind of, this is drooping, besides the wrinkles, you get a little lift. So that Vin Uplift, which is from frozen grape wine. You know, have you heard of, so they leave in Switzerland grapes frozen on the vine. And
I
they
heard
make the
about
ice
this.
wine. And
I love
with
wine.
this, these are only harvested a couple times a decade, and they've shown in pilot studies that it helps reduce wrinkles, but gives you a lift.
Wow.
And helps with hydration. So everything in here is fine lines and wrinkles, glow luminosity, and also hydration. And these things, this is cool. These are your detox pads.
Saw these out front.
The detox pads, instead of using soap and water, and we did a Vizia study, and these clean the face 108% better than soap and water.
What's in them?
And it actually has glycolic and salicylic acid in them,
Okay.
and some other
that.
great ingredients. Takes off makeup a heck of a lot better. Also, it's great for acne.
Oh,
or
good.
edges.
Is it okay
Like
for
my
on the
son
eyes?
is using this. You can use it on your whole face. Take
Okay.
off, and he uses these every night for his
Awesome.
acne. And so this also helps with fine lines and wrinkles because it has glycolic acid in it. So these detox pads, you know, are incredible sizes.
What's your best seller?
And I have to tell you, all of these are
All of
incredible size. But the biggest seller probably overall is that.
serum?
Yeah,
The serum's awesome.
So here's, let me see if I can pull one of these out. Let me put this down 1 second.
For you.
Now watch this. So look at this. Now here's,
Oh,
here,
wow.
look at the size of these are over.
Yeah, they're nice and
Now
big.
watch this. And there's 60 of them. Watch this.
Wow. There's so much liquid in that. That's
So
fantastic.
these things are really. So you get 60. By the way, the other thing is these things. If you take a look, usually these are half ounce for the eyes.
Yeah, these are. I
This is
noticed
full.
at 1.8, or
Yeah.
this is 1 fluid ounce.
This
Yeah,
one,
that's a lot.
or this
30
one
ml.
here. This is like, how big is this one? This one
That looks
here
like it's
is-
over 30 ml for sure.
I mean, this is 2 fluid ounces.
Yeah, that's a
so
lot.
These things last a long time.
Awesome. Well, thank you so much for doing this. Thank you for the Botox, sorry, and the walkthrough of your skincare line. Where's everything available again if they want to shop?
So either at my office, if you guys are in Beverly Hills, you can always drop by, or nassifmdskincare.com, or go to hsn.com and then type in Dr. Paul Nassif, and then it has my whole kind of
Awesome.
line. And I go there every 2 months. I think I'm going there the weekend of March 16th.
To sell more?
So I got to go there on air. It's hard to do that.
It's super hard. You get like the weird time slots where you're like up all night and
sometimes
you're a
but
pro.
But it's fun doing. It's different.
Yeah, definitely. Well, thank you so much for having us
you're
here.
all
This
set.
was awesome. Thank you, doctor.
And you know what to do?
I know what to do.
Bye, everybody.
Bye, you guys. Mwah. Bye.